You get a cancer diagnosis. I mean, every single day feels critical to it.
Absolutely. Time is just everything.
And studies, they've actually shown that for patients needing radiation therapy, just a month's delay, 1 month, in starting treatment can be linked to roughly a 10% higher chance of mortality.
That's a heavy statistic. Really underscores how vital quick access is.
It really does. So our deep dive today, we're looking past the numbers to uncover something often hidden.
Hmm.
What actually dictates how fast someone gets that life-saving cancer care? It might affect you or someone you know.
Yeah, it's a crucial question.
Okay, so let's unpack this. There's a recent study, pretty comprehensive, looked into exactly this.
Right.
Researchers went through over 9,200 patient referrals. This is over 4 years, to a radiation oncology department. Now, out of those, 5,321 patients actually attended their first consultation.
Okay.
And the study measured access, simply,
Hmm.
how many business days passed between getting the referral and having that first appointment?
Simple metric, but reveals a lot. And what they found, what predicted significant delays, is pretty striking.
What stood out?
Well, it really boiled down to two main things. Low socioeconomic status, SES, as it's often called, and black race.
Okay.
Get this, 26%, a full quarter, of patients in the lowest SES group had appointments pushed out more than 21 days after referral.
More than 3 weeks. Wow.
Yeah, compare that to only 12% in the non-lowest SES groups. So if you're in that lowest income bracket, you're basically twice as likely to face these long waits.
Twice as likely. That's significant.
It is. And for Black patients, they were much less likely to get seen quickly, like within 5 days. Only 17% of Black patients got in that fast versus 24% of non-Black patients.
Okay, so race played a role in that quick access window.
Exactly. But here's the really critical part. When they did the multivariate analysis, statistically controlling for all sorts of other things, age, insurance, distance, whatever.
Right. Trying to isolate the core factor.
Precisely. Socioeconomic status, the SES, was the only independent factor strongly linked to those longer delays, the ones over 21 days. Low SES patients were nearly 4 times more likely to hit that delay mark.
4 times. Just based on SES when you filter out other potential reasons.
Just based on SES, according to this analysis.
That's quite something. But just as interesting, maybe even more surprising for some listeners, is what the study didn't find strongly predicted these delays.
Yeah, that was illuminating too.
Things you'd maybe expect, like language preference, age, gender, even insurance status, or how far someone lived from the clinic. None of those jumped out as independent drivers of delay in this specific study.
Right. Which really makes you think, doesn't it? It challenges some of those common assumptions about access barriers.
It absolutely does. So
Yeah.
what does this mean in the bigger picture? What are the implications here?
Well, thinking bigger picture, it shines a harsh light on health equity issues. Now, the study didn't pinpoint the exact why for these specific gaps. It wasn't designed for that, but it points towards some deep societal challenges.
Like what?
Things like logistical hurdles. Think about coordinating childcare, maybe caring for elderly family members, or a big one, transportation.
Ah, yes. Getting there.
Huge. Our sources mention nearly 6 million patients in the U.S. Miss out on care just because of transportation problems, and it hits lower income folks disproportionately hard.
That's a massive number.
It is. Then there's what some call financial toxicity. Healthcare costs are just spiraling. One source said 29% of adults reported delaying treatment because of out-of-pocket costs.
Almost a third.
Yeah. And the U.S., compared to other developed countries, has the biggest health disparities based on income. Stark differences.
And beyond the practical stuff.
There are psychosocial factors, too. Fear, maybe despair, or just a lack of trust in these big, complex medical systems. That can definitely contribute to delays.
And for the patient, these delays aren't just inconvenient. They're potentially devastating for cancer outcomes.
Absolutely. It can break the continuity of care, raise the risk of complications.
And the cancer itself can progress, right? What they sometimes call upstaging.
Exactly. The disease advances to a more serious stage. For some cancers, even short delays can sadly impact survival.
So the core message seems pretty unavoidable. Your socioeconomic status, which is often tied to, frankly, your zip code,
Your address, yeah.
plays a really significant, measurable role in how quickly you can get in to see a radiation oncologist. It feels like a postcode lottery for potentially life-saving care.
It does raise that uncomfortable question, and it leads to the next point. What do we do about it? What interventions are needed?
What does the study suggest?
Well, it calls for pretty specific actions, targeted help for low SES groups in underserved areas, Things like community-based education programs, making sure they're culturally sensitive,
Yes.
and developing better financial navigation, patient assistance programs. Things to tackle those real-world money and logistical barriers head-on.
So it really leaves us with a thought, doesn't it? Thinking about these findings, what's our role? As individuals, as communities, what's our responsibility to push for and maybe help build healthcare systems that are truly equitable, where your address, your income,
Yeah.
it just doesn't determine if you get timely, life-saving treatment?
It's a question we all need to wrestle with.